What if I told you belly fat has very little to do with abs exercises and a lot to do with four hidden lifestyle factors? You have done crunches, you have tried green tea, you have dieted, restricted, even punished your body. Yet the belly fat stays. Let's break this down simply, scientifically, and without myths. Most people believe that doing hundreds of crunches will flatten the stomach. But here is the truth. Abs exercises strengthen muscles. They do not directly burn belly fat. Fat loss happens through whole body metabolic processes, not spot reduction. In fact, organizations like the CDC and NIH clearly state that localized fat loss through specific exercises is a myth. So why does belly fat really accumulate, and what supports reducing it? Let's understand the 4 S factors. Number 1 is sitting, the silent fat builder. Modern life keeps us seated for hours, at desk, on screens, or even at home. Research published in the NIH and WHO shows that prolonged sitting is associated with increased abdominal fat, even in people who exercise regularly. Why? Because long sitting slows down calorie usage, blood sugar regulation, fat metabolism. What helps? There is where NEAT comes in. NEAT means non-exercise activity thermogenesis. Small movements done throughout the day, standing, walking, stretching, stairs, even standing up every 45 to 60 minutes, 1 to 2 minutes of light movement, a short walk after meals. Research suggests NEAT can contribute significantly to daily energy expenditure, sometimes more than structured workouts. Second one is sugar, not just sweets. When we hear sugar, we think of desserts, but hidden sugars are everywhere. Packed snacks, bread and bakery items, sweetened drinks, refined carbohydrates. According to the WHO, high intake of free and added sugars is linked to weight gain, insulin resistance, increased abdominal fat. Sugar provides high calories with low nutrition, which may increase fat storage, especially around the abdomen. What research suggests? Instead of extreme restriction, Nutrient-dense foods may help regulate appetite and metabolism. Two important categories: protein-rich foods. Studies from the NIH show protein has a higher thermic effect, meaning the body uses more energy to digest it. Next, fiber-rich foods. Fiber supports gut health. Research indicates a healthier gut microbiome is associated with improved weight regulation. Whole food, vegetables, fruits, legumes, whole grains naturally contain fiber. Number 3 is sleep, the overlooked fat factor. Sleep is not rest time for fat loss, it's an active repair time. According to the CDC, adults who sleep less than 7 hours regularly may have higher stress hormones, increased appetite, and altered hunger signals. Poor sleep is linked with greater abdominal fat accumulation, not because of willpower, but biology. General sleep guidance: aim for consistent sleep timing. Prioritize quality sleep. Reduce late night screen exposure. Fat metabolism, tissue repair, and hormone balance are strongly influenced during sleep. Number 4 is stress, the invisible trigger. Chronic stress raises cortisol, a hormone associated with fat storage, especially around the belly. The NIH notes that long-term stress may influence eating behavior, fat distribution, metabolic health. Extreme dieting, food fear, and self-criticism can increase stress, not reduce fat. Supportive practices: slow breathing, mindfulness or meditation, light yoga or pranayam, enjoyable hobbies, time in nature. Stress management is not optional, it's a part of metabolic health. Why belly fat matters? Abdominal fat, especially visceral fat, is linked to higher risk of type 2 diabetes, heart disease, and metabolic disorders. The WHO and CDC emphasize waist circumference as an important health indicator, not just weight. This is about health first, appearance second. So, final message, the big picture. Belly fat is not a failure of discipline. It's often a signal from the body. Your body is not your enemy. It has built-in systems. for balance and healing. When we support it with regular movement, balanced nutrition, quality sleep, and stress awareness, we work with the body, not against it. Now, this video is for educational purposes only. It does not replace professional medical advice. If you have health condition or concerns, please consult a qualified healthcare professional. You don't need extreme rules. You don't need punishment workouts. You need understanding, consistency, and respect for your body. Because the most advanced health system in the world is already inside you.